wonderful virtual time. And with that was the, we're moving into our final remarks. So this has been a wonderful day. Let me introduce Dr. Nandita Manning. In the year and a half that Nandita has been at the Health Sciences Library, it has been a place transformed. So just the other day, we had our all-staff meeting, and we were talking about all the things that are going on, and it's truly unbelievable the number of things that have changed at that time, as she's been a transformative leader. Under her leadership, areas such as digital health, impact measurement and visualization, consumer health, and other areas have thrived. And she has also led to new partnerships with the Carolina Health Informatics Program, CHIP, that we talked about earlier today. Interprofessional education and practice, those have become very strong partners with us, and even taking space on our third floor that's growing. She's been a champion in innovation, and actually was the inspiration, the suggester of having this symposium. So with that, I'd like to introduce Dr. Manning.
So thank you for that. I am so happy to be here. I'm so proud that it was the HSL that is hosting the first Digital Health Symposium, and that is no easy feat, so a very special thanks to Brian and his team. So I he did a phenomenal job, and really the desire to have the symposium was also because of the great work that Brian has been able to do on this campus. And when we talk about somebody who's really eager to get people connected, talking about the different types of work, Brian's been instrumental in that. So, he mentioned things such as the AR/VR interest group. That's just one example of the kind of work that he's done to encourage collaboration on our campus and beyond. So talking to our industry partners, our not-for-profits, and that cannot be understated. So I really do appreciate the efforts and of the team as well at HSL. I also want to thank the speakers today. What a great variety of perspectives. When I think of digital health, there are so many different ways that this can be interpreted and kind of felt, right, in terms of the research, the clinical, and the academic enterprise. There's so many different avenues at which you can approach digital health, and I thought that the speakers today did a phenomenal job in describing all the different aspects of AR, VR, mobile app development, the different devices and bubbles. We'll have to think of a fun word for all the different words that come out. But those are things that are changing each and every day. And I think that's one of the challenges, is how do we keep up with such an ever-changing landscape that also has different forms of application. So everything we have talked about today is ultimately taking on what Jason in the morning has said, is it's all about human health, right? That is why we are doing what we are doing. It's all about the information that we are collating, and it's the interpretation of that to hopefully create something very meaningful and that can be utilized. I also thought it was wonderful to bring in the patient perspective. I truly appreciated that, because in my work around curriculum design and development, a lot of what I've talked about through interprofessional education or medical education is bringing in the patient perspective. And when you talk to users or patients, they want to be part of the process. It's part of that participatory engagement opportunity. So when we talk about healthcare interventions, right, the design of apps, we talked today about engaging, in this case it was the pediatrics, right? It was the children in this particular unit to be able to design what this particular intervention could look like and how it could be utilized. And that's the kind of thing I think is only going to be growing. So as we look at the various devices, how they can be utilized in a healthcare intervention as an example, we need to somehow bring in the user perspective to understand how they are actually going to be able to utilize all the various assets that we're actually creating, so that it is something that's actually meaningful from which we can actually utilize really good data and to make informed decisions. And that's what the Health Sciences Library is all about. I would really like to implore you, connect with us. Brian talked about our new partnerships that we're also going to have with the new Office of Interprofessional Education and Practice at the library, as well as our strong relationship with our Carolina Health Informatics Program. The library is about our people. It's about our strengths in data visualization, data management, health fluency or health literacy, and ensuring that we are actually providing information that people can understand. It's about our digital devices. but it's taking all of that and applying it to the work that all of you are actually doing. So the projects that Brian talked about, we want to stay engaged with you, and we want to be able to consult or be able to provide our area of expertise, whether it's on metadata, whether it's wrangling data, trying to figure out what an intervention could look like for your patient or your population. We want to be there, and we are happy to be there to either assist you directly or, like we're doing today, connecting you with each other, because I think that's the only way we're going to be able to grow this and make it even more meaningful. The other thing I thought I would just say, based on the great ARVR talk that Jason just gave right now, is the educational paradigm. I think we have a huge, huge opportunity around digital health to foster an entire new generation of people out there who not only want to participate in what we're already doing, but there's no track, there is no field right now where somebody can go get educated on what does it mean to be, I don't know, a digital health specialist. What's your track to becoming a digital health specialist? And the whole point is that there is no one track, right? There are multiple ways, just as we heard today, in how people can grow in these areas, whether they're coming from an educational paradigm or from the healthcare environment or public health or business. So we need to figure out a way to be able to cultivate the interest that already exists. UNC campus is a great opportunity. We heard about the students that are coming together today to create this mobile app for actual utilization in our healthcare environment, right? That's huge. So how do we take that as an example and create something that really delves into the concept of experiential learning, goes from that pedagogical approach where we're not just hearing about it, we're participating in the creation and development and hopefully the implementation of something. How do we do that and streamline it so that it's not just one group? We have students from art. We have students that are talking about music therapy, right? That's part of interventions. We have people from School of Media and Journalism as well as our health affairs schools. That whole concept of interprofessional education can be applied to digital health on our campus. So I think that there's a huge opportunity there, and I would just encourage you to maintain communication with us. This will not be the only symposium. I'm happy to say it's a first, but it's definitely not the last. I was talking to Brian and Robert. We will definitely have this on an annual basis, and it's because of also your support. Your support for digital health, but also your support of the library. We aim to be a central hub. HSL is in a wonderful position on our campus to be that hub. So when you think of the library, think about us when it comes to some of the areas of expertise that we do have that relate to our services, but our ability to partner with you. And again, we are so happy to have you here today. And thanks again, special thanks to the speakers that came today. Thank you.
And so with that, to wrap up, this is the part of the schedule that says networking. So please stay around. The people who are doing demos will still be around, including upstairs on the 5th floor that we talked about, the people who are doing demos, and please just stay around and talk to each other. Thanks very much.